morning, Paul, Mr. Banwell. How are you?
I'm good, thank you, Nadja. How are you? Lovely to see you.
Very well. Nice to see you as well. So thank you so much for agreeing to this little chat stroke interview. So do you want to quickly just introduce yourself?
Well, it's lovely to be invited to chat, and I do appreciate it. So my name is Paul Banwell. I'm a consultant plastic surgeon, and I'm based in Harley Street at the Banwell Clinic. But I also have another Banwell clinic based in Sussex in East Grinstead.
Lovely. So those who don't know me, I'm Nadja, and I'm the director at Macom Medical. So we specialize in medical graded compression garments, and that's how our worlds meet. You know, you deal with the surgery, obviously with the aftercare as well, but we handhold your patients through the healing recovery journey. So we're here to talk about breast surgery today, which I know it's not the only procedure that you do, but it's a large proportion of what you do in your practice. How much would you say breast surgery incorporates in overall what you do?
Yeah, as you say, you know, Nadja, I do a lot of cosmetic surgery all over the body, but I suppose one of my main interests is in cosmetic breast surgery, and this really probably accounts for 60 to 70% of my total cosmetic surgery workload, so quite a lot. And of that, as you'll be aware, most of that is breast augmentation surgery, which is with implants alone or hybrid techniques using fat transfer. But then we also do breast reduction, we do breast uplifts, and then we do combination hybrid techniques with fat transfer as well.
Yeah. What's your favorite?
Well, I love all surgery, but breast augmentation, of all the breast surgeries we do, probably hybrid breast augmentation. So using implants, I have a particular interest in Motiva implants. So I use Motiva implants, and also using fat transfer. So that's called a composite technique or a hybrid technique.
Right. Interesting. So I've worked in the aesthetic industry, medical industry for many, many years. And, you know, 20 years ago, for instance, 15 years ago, fat transfer to the breast weren't that common. And I think, what would you say is the benefit today by adding fat together with an implant? What can a patient expect in terms of the result?
Yeah, it's a really good question, actually, because as you say, a decade ago, fat transfer wasn't that common. And the reason for that is that when you transfer fat from one place to another, you need a blood supply. And the problem was that the processing of that fat was really important. But now our techniques that we have and the methods of processing the fat are far better. And what that means is that the fat take rates are much better. We also know that there's a bit of a vogue to be going on top of the muscle now rather than underneath. And if we can somehow cover and get a really good coverage of the implant in addition by using fat, then that's a benefit too. And fat is almost like a finessing procedure. So it's like a fine and artist's way of just sort of finishing off a technique. And it's very, very good for the cleavage and for the upper pole. And many of my patients really love this, and that's why it's become so popular.
Got it. So is it also, does it give a more natural result, would you say?
Well, using the term natural is very interesting because some people think natural is related to the size of the implant. Some people think it's related to the pocket that you use or whether or not you use fat or not. And I know you and I are laughing about it because we know that patients' perception of natural are completely different, and surgeons and indeed other people in the industry. And I think coming back to it's the total package. We're going to talk about compression garments as well, but you know, compression techniques are really important as well in the aftercare for fat transfer too. So it's really, really important. And it's that whole, it's identification of the patient, making sure that you communicate with them, that they're happy with the plan, and that you make sure that as well as the consultation process, the surgery, but the aftercare is also just as important. Yeah.
I mean, I think the terminology is subjective when it comes to natural result. It's, you know, I know we're laughing about it, but it's not been funny in that aspect. But, you know, one patient comes in and say, oh, my friend had, you know, 460cc implants and it looks so natural. It doesn't mean because you're going to have 460cc implant, it's going to look natural on you. And I suppose that's where you come in with your expertise and your bespoke recommendations. Does it happen that patient come in and they say, oh, I want, you know, have just breast implants, and then you go, well, you have to explain to them that maybe they would benefit from having a different technique, fat transfer, hybrid, together with implants. Is that common?
Correct, absolutely. In the majority of cases, an implant alone will satisfy the requirements, and we can get some fantastic results, and our patients are extremely happy, and the patient satisfaction rate with breast augmentation with implants alone is extremely high. But as we've just been discussing, we now know that using fat transfer is an additional or is an addition to our armamentarium that we have as surgeons, but also a choice, an additional choice for patients. So it means that the more choices that we can offer, the better. I think the technology in implants has changed dramatically as well. And with the with the latest technology implants that I use, which are nano surface, we've got a microchip, they've got a very soft ergonomics gel. It just means that that's yet another advance, yet another choice for patients, and that can only be good. As you also know, it's really important that we educate our patients, because there's so much stuff out on the internet that people think they know things, and they think that they know what they want, but what they want and what they really need, maybe as you're intimating, maybe two different things. And so going back to what you said about natural, 460cc implant is pretty big implant, and you need quite a big natural breast to begin with, because you need the ability to stretch. And of course, if you're a tiny girl, size 6, there's no way you're going to fit a 460cc implant in. So you have to tailor. It's a bespoke approach, and you have to discuss with the patient always.
Yeah, I think also discussing the longevity, because the implants obviously aren't, are they lifetime devices? You're gonna
yeah,
it's just one of those. Sorry, go on.
No, you're absolutely right. We know that all implant manufacturers recommend replacement after 10 years. And so it's really important that patients realize that they're not devices for life. They do need to be replaced, and that needs to be taken into account when making decisions and informed consent.
Exactly. I mean, is that something you discuss with your patient in terms of, let's say you have got a patient, tiny frame, who wants 460, 500cc implants. I mean, theoretically, imagine you can do the procedure, but what that patient can obviously expect in terms of the future, gravity doesn't discriminate, having big implants is a big commitment. I'm thinking from the aspect, obviously, with compression garments as well. You're gonna have to maintain those implants, and that decision you made, do you tend to discuss that with the patient when they sort of go against what they should really be having, in your opinion, I suppose?
Well, it's very interesting. I'm very blessed that most of my patients are very, very sensible, and they know what they want, and therefore their choices are usually very sound. Right. And on occasions, I have to direct them, but in the main, that we converge together to form a plan which is the right one for them, and that is possible from a surgical point of view as well. As you're intimating, is when there's a mismatch in terms of expectations and what we can achieve are really important. And as you're also saying, the bigger the implant that you have, gravity then plays a role, and also the quality of the skin is really important. And if you've got very stretchy skin, then the bigger the implant you go, your breast will stretch. And so that also comes in terms of the aftercare, because if you can minimize that as much as possible with good quality compression garments with high technology or the latest technology materials as well, then that's obviously going to support the breast as much as possible. But ultimately, it doesn't change the quality of the skin or the weight of the implant.
Got it. So obviously surgeon selection is important, compression garments is important as well. How do your patients, do they tend to come by personal recommendations? I know you've got so many mentioning in, like, the glossy mags, Tatler, etc. How does your patients tend to find you?
Yeah, I'm very fortunate that I get a lot of personal recommendations from other patients, so that's really great. Obviously, social media and Instagram is very popular now, and obviously, as you mentioned, in the media, Tatler, etc., and in the press, then we get interest from lots of different avenues. So we're very lucky.
Good. So obviously, I want to talk a little bit about compression garments, and you know, we have many different kind of garments. I mean, we got sleeping bras, we got second stage bras. I suppose you don't really deal with those sort of later stage garments, but obviously the initial post-surgical garments that we do. So all of our garments are seamless, expandable cups, which takes the whole conundrum of guessing post-surgical sizing. Do you have a garment that you tend to go to recommend to your patients?
Well, it's a really good question, because as you know, I've been a big fan of, Macom bras for a long while. And I think what's even more important to me, as you get more experienced and you see what your patients like and don't like, comfort's really important. But also, and Macom signature bra, they're all extremely comfortable. Now, from a surgeon's point of view, but also from a practical female point of view, a front loading bra is actually really important, because you don't, any bra that you have to put your arms up and to actually try and put it over is potentially disrupting the breasts. So as modeled, thank you, Nadja. So a front loading bra is really important. And I think that is from a surgeon's perspective, a priority. Comfort is also a priority, and you mentioned about seamless bras. There's nothing worse than having something that rubs, on your skin. So that's important too. For me as a surgeon, and one of the things that really attracts me and has attracted me to Macom bras is your technology. Now, we've talked about Motiva technology for implants, but where you come into your own and you blow everyone else out the water is in terms of your materials technology. And that for me is fantastic. So you talked about so being a bit of a nerd as well. I'm fascinated by your logarithmic.
I didn't want to say it. You said it.
But by your logarithmic expansion.
Yes.
So as you just mentioned, you don't need to then worry about what cup size bra to get, because it's going to stretch. So you worry about your chest circumference, and that is actually really important. So purely from a scientific point of view, from a nerdy point of view, the concept of a logarithmic expansion that your design encompasses is really, really fascinating, and all of our patients love that. And so you're still providing that support. And I'm interested, how did that come about when you were doing the design? Was that difficult to incorporate?
Well, the actual design process, it was a long process. I mean, it came from the difficulty and the anxiousness that patients were going through in choosing a bra. You know, I worked in clinics myself, and I've been alongside patients, hand-holding patients when they've decided to go ahead with the surgery. They've told their family they're having the surgery. You know, there's so much emotions going through someone's mind, you know, organizing childcare, and then they're ready to go, and the excitement starts kicking in. And then it's like, so what bra do I get? And then if you tell the patients, well, go to, I don't know, high street bra, buy a sports bra, then most of the sports bras are the ones that you put over your head. So you're going to lift up your head, but you're told you can't lift up your hands after the procedure. And then it's, what size do I get? You know, I'm a 34 bra size, but I'm an A cup, B cup now, and I'm going to be a D, double D. You know, breast implants don't work in A, B, C, D cup size. So what size is it going to be after the procedure? Now is with the anxiousness in this patient start kicking in, because the bra is part of the aftercare. The same way you're giving antibiotics, you're getting your pain relief, and some, you know, you got some vitamins that you give to your patients as well. You know, it's part of your aftercare. So why should the bras be complicated? It shouldn't be. There you go. Yes, exactly. So to get the aftercare kit, and if something isn't aligned, you know, in terms of the patient's not comfortable in their compression bra, the patient doesn't feel safe in the bra, they start to question everything. So our bras, our compression bras they're not fancy lacy lingerie. There's going to be plenty of time for patients to enjoy that afterwards. They are medically designed to optimize the result for the patient, to make it comfortable for the patient. It's from where the design came from. There was a need for something straightforward, medical graded, and I think also professionals in clinics really enjoy wearing it because it makes their life easier as well. You don't have to have the conversation about ABCD cup size because the bra takes all that away from it.
And I think what I found as well is that you provide fantastic support. So I just ask my patients to phone you and your team, to speak to them, and they get first-rate support. And I think that knowledge as well, and the fact that there is somebody to go to who specializes is really, really important. One of the things I was going to ask you as well is I've been recommending my patients crystal smooth garments as well. Now, as you know, I'm very skeptical as a surgeon. And when you first told me about crystal smooth garment technology, I was a little bit, there you go. Yeah. I was a little bit skeptical and said, does it actually have an effect? But many of my patients have tried it and love it. And now, as you suggested, use it as leisure wear, both, because it can improve skin quality. So just, do you mind just explaining about sort of a little bit about crystal smooth technology and how that works?
So crystal smooth, so we got two ranges. So we got the surgical side and then we got the aesthetic side. So crystal smooth comes under the aesthetic side. It doesn't have any compression in there, but what it does have inside the material, and it's an active biocrystal. This active biocrystal, when it gets in contact with your skin produces heat. So the heat in your skin goes inside the crystal and converts this energy into far infrared rays. So the only thing you need to do is to put these garments on. The most popular is these crystal smooth upside down.
That's even upside down.
Yeah, I know.
So you have to do a handstand when you try them on. Yeah. Okay.
Yeah, I'm working on that one. Yeah, they look and feel very, very soft and silky to touch. So this is a pair of leggings.
And, do you have tops as well, Nadja, as well as the leg?
Yeah, so we got loungewear, and I've got something really exciting new to show you as well. So we got the loungewear, which comes as a set. So you got the top and then you got the bottom. So what happens is when these far infrared rays start going inside your body, it increases blood microcirculation, it unblocks the lymph fat cells, it's thermoregulating as well, which means that it doesn't actually heat up the skin because it uses the heat as active energy source to increase these good things within your body. But the material will actually balance your body temperature, so it's a joy to wear. It's very, very comfortable. You can use it straight after surgery, but obviously you need to wear your compression garments because these don't have compression, but you can wear it over it to improve your lymphatic drainage. So obviously when you have surgery, you want to have good lymphatic drainage because it enables your body to heal better.
So basically, my patients, if they're having breast augmentation and liposuction, for instance, they could wear their compression garments to begin with, but then afterwards, as leisure wear, they could then wear their crystal smooth garments as a second stage to help improve their post-operative recovery. Yeah.
So they're scientifically proven to reduce cellulite. So I appreciate someone's going through with liposuction, may not initially think about cellulite being a concern, and cellulite isn't a medical condition as such, but it bothers a lot of women. Okay, so the extra benefit of wearing them as a second stage garment is that it actually helps to reduce your cellulite as well, and drain any sort of, even though you've had very successful liposuction surgery, some redundant fat cells might still be linger in your body, which means that the lymphatic drainage system will help to expel those even further.
Yeah, what I found with my patients, which I love, is that breast surgery as well, I've got them to wear it, especially following a mastopexy or indeed a breast augmentation, is that I think that has additional benefits as well. And especially when I'm doing fat transfer, so we talked about fat transfer right at the beginning. Yeah. When I'm doing composite techniques, I do nanofat, so I do injections of nanofat into the skin as well as macro fat for contouring. So I find that the crystal smooth is actually helping improve the skin quality together with my nanofat. Yeah. And that for me is an exciting combination, that you've got surgery and latest materials technology coming together to help benefit the patient.
Yeah. So one of the first things when you start wearing the crystal smooth technology is that you notice your skin start to feel very soft and smooth. That's usually the first sign. The second sign is that you tend to go to the loo quite frequently because your lymphatic system start working. So you need to go to the loo a lot. And anti-cellulite reduction, it usually starts sort of like between 30 to 60 days. Already at 30 days, your blood microcirculation is improved by 60%. At day 60 of wearing them every day, your blood microcirculation is improved by 88%. So you can expect to see the real sort of dramatic results, usually 60 days after the procedure. I want to show you a new product which we have. You're one of the first people to see this. So we made a face mask in Crystal Smooth combined with compression. So it's a hybrid face mask. So this would go sort of chin, top of the head, and then you got this strap to keep it in place. So it's great for sleeping. And then this goes at the nape of the neck. So it combines the two technologies. So the medical grade compression together with the Crystal Smooth. So that's a very new, in fact, first of its kind product.
So we have hybrid techniques in surgery, and you have hybrid technology in your surgical garments as well. So that's very exciting. So I'm really excited about trying that in my patients as well. So thank you for showing.
It can also be used for also non-surgical patients. So you don't need to have a surgical procedure to wear it, because you've got a lot of lymph nodes here. So when you wear this, obviously you stimulate the lymphatic drainage system. So if you sleep in it, you will usually notice the following morning that you'll have more contouring in your face and less puffiness.
Great. So that's an exciting thing to add to the non-surgical armamentarium as well, especially having facial contouring for fillers or fat, etc. So that's, or indeed nano fat as well to the face. So that's very exciting.
So Paul, what happens when compression garments are avoided?
That's a really good question, actually. Now, as a surgeon, I'm passionate about the importance of aftercare. And I think for me, compression garments are an essential part of the whole operation. So just as we talked about before, in terms of an operation is a process. It's not just a single event in theatre. It's the preoperative consultation and all of the discussion. It's the operation itself, but then it's also the aftercare and about doing the right thing. I believe personally that if you do not use a compression bra, such as my favorite is the Macom bra, as you know, if you don't use that, it does affect the final result. So to use a good quality compression bra to keep the breast in that shape and in that position, especially if you're using implants, it's really important that the skin is supported and the implants are supported, and that they can mold into their position.
Yeah.
In certain cases, I will also recommend the use of a kick strap, which is a band that goes around the outside of on top. Thank you. So that's, there you go. Thank you for demonstrating. So a kick strap, I don't use it in every case, but where we want to try and stretch out the lower pole a little bit more and prevent, especially for patients that have a very high riding implant where we're replacing them and we want the pocket to compress down, then I recommend these. So that's an important addition as well. So for me, to answer your question, compression garments are absolutely essential, and I would always recommend it. And in actual fact, I believe that if you don't use a compression bra, then the outcome will not be as it should.
Another thing which I do find, we speak to a lot of patients in the healing journey, is the discomfort. So patients who haven't, not just with your patients, but patients who haven't worn compression and then introduce a compression bra maybe at 10 days after the procedure, they put the compression garment on and they're like, oh my God, I feel so much more comfortable, because it helps to drain out the fluid. The more fluid you have within the wound, the more discomfort you're going to be feeling. And we shouldn't underestimate, like we mentioned earlier, patients feeling comfortable in the healing journeys.
Yeah, you're absolutely, it's a very underrated reason as well. And that, that reason is just as important. So comfort and a decrease in pain is obviously one of the main reasons for using compression bra. And so it's about outcome, but it's also about comfort.
Yeah. Another thing as well, late onset hematoma, which is something which is rare, but that's why we recommend wearing the garment as well, not just for a week after the procedure, wear it for 6 weeks after the procedure. To obviously there are some small risks associated with any kind of surgery, and to minimize those risks even further, wear the garments for minor procedure. We will say normally 6 weeks. Would you agree with that?
Yeah, I'm really particular, and I extend it even further. So I actually prefer 6 to 8 weeks. So I like 2 months. So that's my personal view. Now we're running a special. You can explain.
Yeah, so we got a collaborative giveaway coming up, which is with your artists supplements.
So basically, as you know, I have set up this artist company, which is specialist supplements for the aesthetic industry and cosmetic surgery industry, which has become very popular to help aid recovery. So it's a whole package in terms of, we talked about the importance of post-operative care. We've just been talking about Crystal Smooth, been talking about your compression garments, but also making sure that you feed your body and your soul is really important. And with artists, we're giving these away as together with some garments. Is that right?
Yeah. So it's a post-surgical bra choice you can choose together with the artist, your complimentary consultation with yourselves, and was there something else?
I'm sure there is, but whatever.
We'll put the details in the caption anyway. So it's the ultimate recovery package that we are giving away to two winners in this competition.
So it's a great package, and thank you very much for doing that. So we're offering some of our services and you're offering yours, and it's a great opportunity for anybody considering. So it's a perfect opportunity. So I think that that will be on our feeds, and if people are interested, then they should sign up and tag their friends.
Sounds good.
But thank you very much for inviting me today. I've really enjoyed talking, and it's lovely to see you, and I hope after lockdown all these measures are easing, that we'll get to see you, and then we can chat further about all these exciting advances. So thank you very much.
That's the plan. Thank you so much. Have a lovely day.
Take care. You
Bye.
too.